Good morning. I'm Muriel Bowser, the Mayor of Washington, D.C. And this morning, we are here to talk about some exciting news affecting the hospital system in Washington, D.C. I am joined today by the City Administrator for the District of Columbia, Rashad Young. I'm also joined by the CEO and Managing Director of George Washington Hospital, Kim Russo, the Vice President for Health Affairs and the Dean of the GW School of Medicine and Health Sciences, Barbara Bass. Barbara is also the CEO of the GW Medical Faculty Associates. I'm also joined by the 17th President of Howard University, Dr. Wayne Frederick. And I'm joined by Terry Ford, who is the President and CEO of Adventist Healthcare. I want to thank all of our partners for their commitment to our community and the health of residents of DC. And we are very excited to share an update with the community, especially right now. I want to take a moment before we get into it to thank all of our healthcare leaders, all of the doctors and nurses and medical professionals who are on the front lines of this pandemic. We know that our medical professionals are making tremendous sacrifices to protect and take care of our community, as they are also focused on taking care of their own families and themselves. And I want to thank them for their courage and great compassion. We know that this response is physically and emotionally exhausting, and we want to continue to support our frontline workers in every way that we can. We, of course, are also focused on health equity, and we have been long before this pandemic. The agreements that we are going to discuss today have been a long time in coming. And what we know is that these two hospitals are going to transform our healthcare system by promoting equity in care, access, and outcomes. One of the frustrating realities that we face, without a doubt, is that we have some of the best hospitals and most talented medical professionals anywhere in the world, right here in Washington, D.C. We also have one of the lowest uninsured rates in the nation. In theory, everyone, regardless of zip code, income, or race, should be able to access world-class care, and we shouldn't have major disparities in our health outcomes given our investment in health care. However, we know that that's not how it works. First, generations of racism and discriminations have put thousands of Black Washingtonians at a major health disadvantage. And in addition to what we know about our history, we also know that today our hospitals aren't entirely evenly distributed across our city, with most of our healthcare centers concentrated in the northwest part of Washington. And right now, COVID-19 is laying bare the inequities in our systems, not just here in D.C., but across our nation. This morning, we announced 217 new cases of COVID in D.C., bringing our total to 4,323. And sadly, 224 Washingtonians have succumbed to the virus. And here's another urgency for all of us. While African Americans make up 46% of DC's population, 80% of Washingtonians who have died from this disease are African American. We talk about the underlying issues that put people at greater risk. And let me just mention a few here, and of course the doctors may want to add on later. 85% of Washingtonians who have died from COVID had underlying chronic conditions, including 70% who had hypertension, 50% who had diabetes, and 70% who had two or more of these conditions. So it is clear that we not only need to be focused on these issues right now as we are, but we need to focus on the investments in the resources that it will take to change those underlying statistics. Because it's not just COVID that is a cause for concern. We know that these underlying conditions cause so many other problems for people in non-pandemic times. And citywide, these results have dire impacts on how people live. The average life expectancy in Ward 8, for example, is 15 years lower than the average life expectancy in Ward 3. This is a number we have been drawing attention to for some time, especially in our conversations around housing. It's unacceptable, and there's no doubt that collectively we can and must do better. And we will do better. I have already charged the Reopen DC advisory group with advising me on how we can implement a phased reopening of our city that focuses on the health of our residents, how we expand and equalize opportunity, how we make sure that our city continues to prosper and comes back from this recession caused by COVID, and that we do so equitably. So that will continue to be our focus. As we announced last night, we are preparing to see 2 new hospitals built in Washington, D.C. First, a 136-bed hospital at St. Elizabeth's East in Ward 8. And that hospital will be operated by Universal Health Services in conjunction with George Washington University, their School of Medicine, and the George Washington Medical Faculty Associates. And second, a 225-bed Howard University Hospital on Georgia Avenue in Ward 1. Through our agreement with Universal Health Services in George Washington, we are bringing a new modern community hospital to Ward 8, as well as a $69 million health services complex that includes an ambulatory care center that will also be on the St. Elizabeth's campus. In addition, 2 new urgent care facilities will be built in Ward 8. We have certainly been working on, and the city administrator will talk about this more, this agreement. We were with our partners at GW and UHS, I guess it's been a couple of years ago, at the site where the new hospital will be built, in the agreements that have been reached in the last several weeks. Submit our commitment to work together to have the hospital built. The new $306 million hospital will open in the fall of 2024 with 136 beds, as I mentioned, and have the ability to expand up to 196 beds. The district, as planned, will fund the construction of the hospital. You can see here some of the services that will be available at the hospital. Of course, all of the lines for service have been previously discussed, as you would expect. ICU, surgery and operating rooms, newborn delivery and women's services, level 2 NICU unit, adult and children's emergency department, physicians, medical students, and research partnership in GW School of Medicine and medical faculty associates. There, of course, will be parking and transportation services linked to the hospital at the Congress Heights Metro Center. I also want to talk about the network of care, and I know the city administrator will expand on this as well. You will frequently hear us say that having a hospital is but one part of a system, and in fact, it's the part of the system that should be relied on least. What we want people to be focused on is prevention and being able to access urgent care facilities and preventative care before getting to the doctor is so important. A sample, of course, I've already talked about some of the services that will be available with the new hospital we show there. Let me just say that the ambulatory center will be funded by the district and is expected to open in 2023. And the 2 urgent care centers will be funded by Universal Health Services and are expected to open in the fall of 21 and the spring of 2022. Together, these facilities will target the specific needs of the communities they're in. And when these facilities open, we expect that many residents who currently travel across the city for care will no longer need to do so. So next, I'm going to show the very aggressive timeline that it will take for us to be open at St. Elizabeth's in the fall of 2024. We will now introduce legislation and the agreements to the Council of the District of Columbia. We will move into contracting with architects and full design of the hospital and ambulatory care centers. You can see some of the more nitty-gritty things that have to be done, including the awarding of contracts. We will open our 801 East shelter, which we're already underway with, which is part of our construction plan at St. Elizabeth's, and break ground on the new hospital in early 22. And you see when the ambulatory care part of this plan will be open as well. So as you can see, we have a lot of work to continue to do to get there, but we have been working on those details for a long time. So now let's talk about another fantastic announcement, and that is Howard University's plan to build a new hospital on the campus of Howard University. We know the very important role that Howard's College of Medicine not only plays in our city, but in our entire nation. Howard University produces more African American doctors than any university in the country. And we know that by ensuring Howard's success, we have more healthcare professionals of color in our city and our nation, and we know how important it is for the trajectory of African American health to have culturally competent professionals and doctors in our city and throughout our country. So we want to thank Howard for all the work that they've done in preparing doctors to serve Washingtonians and Americans. We are also delighted that we could come to this agreement and ensure that for many years, Howard will be able to train the best of the best and the best and brightest to provide that kind of care. So here are some details of what we expect to see with Howard University and their partnership with Adventist Healthcare. Is that by 2026, Howard will rebuild a hospital on their campus that will be a level 1 trauma center as they are now. Academic teaching hospital will be a 225-bed facility that's 600 square feet. And the current hospital would remain open until a new facility is constructed, and we expect that it will be about a $450 million project. The district is committing to $25 million in public infrastructure support and has committed housing a DC government agency at one of the planned new office buildings, in addition to a $225 million tax abatement that would cover part of the construction time for the hospital. The district is also committing $26.6 million over the next 6 years to support 5 centers of excellence at Howard University, and I dare say invest in how these centers of excellence can contribute to healthier outcomes for DC residents. These 5 areas include sickle cell, women's health, oral health, trauma and violence prevention, and substance use and co-occurring disorders. And so like at the new hospital in Ward 8, these centers of excellence will provide care and services tailored to the specific communities of need. And like the new hospital in Ward 8, the new Howard University Hospital will play a critical role in helping us put an end to the disparities that we see played out with our response to COVID-19. So once again, I want to thank everyone involved. I especially want to acknowledge the hard work of City Administrator Young and his team who have been our lead negotiators in these discussions, as well as Deputy Mayor Wayne Turnage, Dr. LaQuandra Nesbitt, and everyone who has played a role in getting us to this point. So I first want to turn to City Administrator Young, and then Ms. Russo and Dr. Frederick.
Thank you, Madam Mayor. And these initiatives really anchor our strategy around how we will address health disparities in the district. The mayor's charge to us has been clear that we need strategies that really tackle and make a meaningful difference and transformative difference to the work that we have known, that we've worked on for too long in the district. And these initiatives really complement the work that the DC Health Department has done in their health systems report that the mayor's task force this winter looked at around health systems and how to strengthen the medical and healthcare infrastructure in the district. And so we're happy to be able to support these investments and work in partnership both with Howard University and Adventist and with UHS and George Washington University to provide care and services across the district. The key, I think, point to make here is that this is about a system of care, and the mayor mentioned this before, that we focus on the inpatient hospital facility because it's the big shiny building, but this is really about creating an integrated service network so that patients, for example, in the hospital of St. Elizabeth's, patients that are serviced there can have disease management, community education. They can integrate with the physician services and specialty services at GW Hospital at Foggy Bottom, that there is a network to connect with medical practitioners that are in the community, our federal qualified health centers, and there's a lot of community education at the service level for what we're trying to do to tackle health disparities. And in Howard's case, the mayor's been insistent that a strong Howard on Georgia Avenue is absolutely critical to the healthcare landscape of the district. And having Howard in a modern new hospital focused on these centers of excellence will really help tackle the issues that we've been talking about and then made really more pronounced with COVID-19.
Thank you, Mayor Bowser. Good morning, everyone. My name is Kimberly Russo, and for those of you who may not know me, I am honored to serve as the Chief Executive Officer and Managing Director of the George Washington University Hospital, which is a long-standing partnership between Universal Health Services and GW University. First and foremost, I would like to extend my deep thanks and sincere appreciation to Mayor Bowser and her entire team. It has truly been a journey. We appreciate your collaboration, communication, and diligent attention to develop an integrated system to address the inequities and disparities within the DC healthcare system. Your steadfast approach and tenacity to improving health outcomes in the district is a large part the reason we're here today. I'm thrilled to be here as we announce another step in the journey towards transforming healthcare for DC residents. As many of you know, the George Washington University Hospital, the GW School of Medicine and Health Sciences, and the GW Medical Faculty Associates have a long-standing history of serving the residents of DC. Through this partnership with the district government, we further our commitment to meet the community's healthcare needs by expanding upon that long-standing history and serving the residents in Ward 7 and 8. Together, we will develop an integrated hospital and health services system at the St. Elizabeth's campus. The creation of this vital network will allow us to increase access to high-quality, equitable care for all DC residents. The new comprehensive healthcare services will include many aspects of an integrated health system. You've heard many of those mentioned today. We will have urgent care, outpatient surgery, physical rehab, diagnostic imaging, and most importantly, specialty and primary care physician offices. This network will be designed not only to improve access, but also simply to improve outcomes through comprehensive medicine. The School of Medicine and Health Sciences and the Medical Faculty Associates of GW will serve as the academic and physician arm of this new complex. Together, the GW Medical Enterprise will bring cutting-edge medical services, programs, and technology to this new site, fully integrating it with our current established clinical network. We've always strongly believed that district residents deserve access to the highest quality health care. At GW Hospital, we are providing that high-quality, life-saving care each and every day. And we know now more than ever it is vitally important to provide accessible, comprehensive services for all. We look forward to continuing to work closely with city officials as we enhance care for our residents and position the District of Columbia as a healthcare leader in our nation. We feel this partnership and development of integrated services will provide individuals in our nation's capital with the highest level of healthcare that they deserve. I want to once again thank the District of Government and all the city officials and all individuals across the GW Medical Enterprise who have come together to collaborate on a plan to better serve our community. On behalf of everyone at GW Hospital and UHS, we stand here ready at all times to care for you, and we look forward to serving all DC residents for many years to come. Thank you.
Thank you, Ms. Rousseau. Dr. Frederick.
Sure. So first, let me start by thanking you, Mayor Bowser, for your extraordinary leadership during the COVID-19 pandemic. We are all, as Washingtonians and as employers of large numbers of people in the district, we want to thank you for your leadership. It has been extraordinary. I think DC has led in many ways in terms of your approach to the pandemic, and I think your recent commitment to the Reopen DC committee with taking in a wide swath of individuals with different experiences but representing the entire city demonstrates your inclusiveness as well. So we want to thank you first and foremost. I came to Howard University in 1988 as a 16-year-old to pursue a BS-MD program to get my undergrad degree in 2 years and my medical degree in 4 years subsequent to that. I mention that because at the age of 22 with sickle cell, I was able to graduate from Howard University's medical school and pursue a general surgical residency there. I'm yet to meet someone else in America or anywhere else who has sickle cell, homozygous SS, and is a trained general surgeon who does surgical oncology. I mention that not because my story is exceptional, but because Howard University is the only place in the world, not just here in the US, that can happen. That opportunity has to be an opportunity that we have to continue to ensure is available for many, many more people with stories much more extraordinary than mine. And that's what we're doing today. And this commitment that you have made is a commitment that will ensure that that continues well into the future. This pandemic has exposed something that we have known for some time here, not just in the district, but throughout our country. African Americans are less likely to have the type of access to quality health care, and the social determinants of health are not in their favor in many communities in which they live. This is a significant investment in ensuring that that disparity here in the district continues to be closed. The district has done an excellent job of putting out health equity reports. They've been transparent, the district government, about what the need is, and they have been very, very fastidious in their attempts to try to help close this. This demonstrates that partnership with important institutions such as these two universities in the district would allow us to lead in the country in terms of building a complete health system. This is not about two hospitals, and I want to make sure that we underscore that point that the mayor made earlier and that the city administrator doubled down on. This is about training the next future generation of leaders in healthcare. This is about making sure we close the gap on all the social determinants of health. And this is about ensuring that access is as widely available as it should be for all Americans, and certainly for those who are most vulnerable in our midst. Howard University's hospital was first built as Freedman's Hospital back in the 1800s. It actually predated Howard University's college, Howard University as an educational institution. It predated that, and it was built for the purpose of serving freed slaves moving from the South, and that's why it earns its name, Freedman's Hospital. That was transferred to the university back in 1962, and the university had a hospital built by the federal government in 1971. That public partnership continues today with the District of Columbia making its investment in what I think is one of America's biggest romance stories ever. When you look at the number of black physicians in this country, Howard University has produced more than anyone else. Today, we send more African Americans to medical school than anyone else, and we continue to do that. We have probably trained more black female surgeons in this country than any one single institution. So when you talk about the importance of cultural competency as a social determinant of health, it is not just important for the District of Columbia, but as the mayor pointed out, this is a national and international initiative. The physicians who took care of me and my siblings as kids were Howard University graduates, all the way in Trinidad and Tobago. So the impact of this institution is an international impact. And so this investment really is a tremendous investment. We have a partnership with Adventist Healthcare that allows us to expand our network and our support to bring clinical excellence and managerial experience that is of the best, and that already during this pandemic has shown its fortitude. When we have run low in PPE, our regional partner in Adventist has been able to step in and step up and assisted us with that. As we are expanding our bed capacity, as the mayor has asked for during the surge, they have been tremendous in terms of making sure that that activity is taking place. And I'll close with reminding everyone that today, 50% of the patients at Howard University Hospital with COVID-19 are from Ward 7 and 8. And we are seeing the disparity in their outcomes, unfortunately. So as lives are being lost and impacted, this investment in the middle of this just demonstrates again the extraordinary leadership of the mayor in recognizing that even in this moment, we have to be investing and looking forward in order to continue to close the gap. So we look forward to continuing the partnership. We look forward to being part of a larger ecosystem that supports the healthcare in Washington, D.C. And certainly, I think today will be historic for more reasons than one, but certainly, again, I think will underscore the mayor's leadership and the mayor's vision well into the future. Thank you very much.
Thank you, Dr. Frederick. So we will take some questions, and as I mentioned, we are also joined by Mr. Ford and Dr. Bass, and we'll start. Yes, on topic, please.
Congratulations, Mayor.
Thank you.
Dr. Frederick, I know when this debate was going on in the council, you had people from Howard opposing the GW hospital site at St. Elizabeth's, I understood, because you thought it would take patients away from the Howard hospital. What's the issue now? I mean, how is that resolved? Tell us about it.
Sure, and let me clarify. We never opposed a hospital. We actually are strong proponents of having a hospital in Ward 7 and 8. A large number of our patients come from Ward 7 and 8. What we were concerned about and expressing a concern over was whether or not we would be able to continue to participate there and whether or not our students and residents would also be able to see patients from at that hospital. What this has done in terms of helping resolve that with our partnership with Adventist Healthcare, our students and residents can now see patients at the Adventist sites as well, so there's no concern about that clinical volume. And we've also built an ambulatory practice in Ward 7 in conjunction with Unity, where our subspecialists have started seeing patients at that site last fall. And that practice actually has been going very well. So we still have access to the patient population. Those patients, some of those patients are going to continue to see us as well, and obviously we're going to attract more patients from Ward 1 and 5 as well.
But you're no longer insisting that you be a part of this hospital at St. Elizabeth's.
Yeah, we're not insisting that we be a part of the hospital, because the two things that we were concerned about, which were clinical volume and the ability to make sure that we can maintain that, and also an improvement in our own facility, has been taken care of here today, as well as our partnership that preceded this with Adventist also expanded our volume and our opportunity for our students and residents.
One final question for you, Doc. Tell us about the impact of the COVID situation on Howard. I mean, obviously, you said 50% are from Ward 7 and 8. What's the situation over there?
Yeah, we're continuing to see an increase in patients. We're not overwhelmed. We have expanded our bed capacity, our ICU capacity as well. I think we're seeing similar things to what the rest of the country is seeing in terms of ventilator usage, and the need for ventilators in these patients is also going up. But I have to underscore that more importantly, what we're seeing is some of the psychological impacts this is going to have on all of us for a long while. having an empty campus 2 weeks before graduation is something we all have to take pause and think about. This is going to have a devastating impact for some time to come. The unemployment that has resulted in terms of the change in the economy as well is going to be devastating. And so while we're in this moment, and we certainly are still in the eye of the storm, we do have to be thoughtful about what is going to happen subsequent to this as well. And so we're thinking about that as we think about the fall and bringing students back to campus. I still see this as a university town, Ms. Mayor.
Okay.
I know Boston tries to boast that, but if you do the math, we have more students per capita than any other city, than even Boston probably. So, and that's a big deal. I mean, in our consortium of universities, there are 17 universities. We'll bring 300,000 young people back to this area. So we have to participate in the wider community. So yes, it's having an impact in the hospital, but I want us to recognize that we're part of a bigger ecosystem as well, and we have a responsibility to all the citizens of the District of Columbia to make sure that we do the appropriate things to make sure everybody is safe and healthy.
Yes.
Mayor, back in 2014, former Mayor Gray announced building a new hospital on the grounds of St. Elizabeth's. That didn't go anywhere. I believe from the timeline I looked at in 2017, you were also on board on doing the same thing. What has changed today, and what has changed so much that you believe this is now going to go forward?
Well, we started this conversation knowing that the district wanted to have a hospital partner. We do a lot of things really well in Washington, D.C., but we believe that we should be connected to a system, and that I think Howard when it has that type of partnership now, and we believe that the district's hospital should have a partnership with a larger system. In that larger system, our partner will be UHS in that process. And you mentioned Mayor Gray. He has been very instrumental at the council in securing and protecting the $300 million investment that will go into the construction of the new building, which is very important. So we have all of the you asked me why I'm confident now. We have the agreements in place. We have the funding in place. We've also been able to address some very serious questions that have been raised, and have made a really tremendous investment in making sure that another very important hospital to our entire system, the hospital that is centrally located on Howard University, and it's a teaching hospital and a training hospital for future doctors for America and the world, is all very important. And all of those things are embodied in what we're discussing today. CA?
No, I would just say that to echo the mayor's point, we've been in this negotiation and discussion for more than a year with trying to develop a very complex deal to put this together. The mayor's mandate to us is that we ought to be out of the hospital business, and so it was a really difficult set of discussions to figure out how we could both finance a hospital and have a hospital operated by someone other than us that gets us out of the hospital business. And so we've been working really hard over this last year to put that kind of framework together and really look at how we can support and bolster and preserve and build upon the great reputation of Howard University Hospital in its service to the district. And so with all of these moving parts, there's at least 4 agreements that relate to the deal that we have with UHS to manage the hospital at St. Elizabeth's. And then we've got a pretty significant investment on the Howard side in terms of a tax abatement and capital infrastructure and resources to support these centers of excellence that just really takes time to put together.
Any other questions here? Yes, Mark?
On the St. Elizabeth's campus, why do the residents of east of the river not deserve a level 1 trauma center? Why is this a level 3 trauma center, not level 1?
You sure you want to talk about the distribution of
Sure.
trauma beds in the district?
And so, Mark, I don't think it's an issue of residents in Ward 7 and 8 not deserving a level 1 trauma center. First, there are 3 level 1 trauma centers in the District of Columbia. If you look around the country, I would challenge one to find a locality or area that has 3 level 1 trauma centers in one jurisdiction. What we're trying to do, and what I think is very important to emphasize here, is that we're creating a system of care for the residents of the District of Columbia. And so you don't need to have a level 1 trauma center in every neighborhood of the district to provide that level of care to the residents. When you look at the data of this in the health systems report, and even the data the mayor referred to today, what you see that plagues African Americans at a disproportionate level are these chronic conditions that can be managed, that should be managed with the right intervention, the right education, the right continuity of care. So the things like hypertension and diabetes and cancer, whose prevalence is higher in these communities that lessen the life expectancy, are the kinds of things that we really are focused on. For level 1 kind of care in this system, you'll be able to receive the kind of care that you need that supports emergencies. There's going to be an adult emergency and a children's emergency, pediatric emergency center at the facility at St. Elizabeth's. If there is a very complex procedure needed or a very acute emergency that has occurred, one will be stabilized at this hospital and then be able to have the resources that they need to address that emergency. So this really is about creating this system and access and equity, and this initiative does that.
So if I could just follow up on that. One, will the St. East facility be a STEMI facility?
I'm sorry?
Will it be a STEMI facility? It will be. I think that's good news to the people over there considering the heart disease rates. But you know, you talk about where it's needed. Correct me if I'm wrong, but aren't the highest number of gunshot victims east of the river? And if there's not going to be a surgeon on duty 24/7,
no, I think you mistake what a level 1 is, and the fact there will be surgeons at this hospital.
Yeah, we anticipate that we'll have 24/7 coverage of the
That's
emergency
not
room with
level
surgery.
3.
Well, we will provide that care, and we will expect to have this
You
be a teaching
anticipate-
hospital as well.
So just to be clear, are you guaranteeing that there will be a 24/7 surgeon on duty at this hospital when it opens? Because level 3, as you know, doctor, does not call for that in any.
Right. We realize that. I think it will be a work in progress, but we are anticipating that we'll be able to have surgical coverage in-house 24/7 once this facility opens.
And then can I ask how you're going to pay for this? I mean, we just sat in this room the other day with the CFO telling us that he's going to have to cut $1.5 billion, or you're going to have to cut.
We're going to have to cut.
That you're going to have to cut $1.5 billion over the next 2 years. It seems that now you're going to be adding $700 million to that figure.
So let me back up there. Certainly this budget is an incredible challenge. Make no mistake about it. Cutting $721 million out of the operating budget in this fiscal year and $750 million next fiscal year is no easy task. Cutting $1.2 billion out of the capital budget is no easy task. But the district still has a budget of about $7 billion, $8 billion. We still have a capital budget that is about $6.5 to $7 billion. So there are resources to be invested. And what we've got to do is make critical choices, and the mayor's got to make critical choices about where those investments ought to go. And we recognize that addressing this issue of health disparities and making sure that there is access, that we can address what are these inequities, is where we have to make decisions to invest money. Thankfully, the capital budget already had $300 or more million for the construction of this hospital, and we're able to preserve that in the capital budget by making some trade-offs and some frankly very difficult choices. But we see this as a critical investment for our community, for the residents of the District of Columbia, and so we're proceeding in that fashion.
Bennett from the Washington Post. I don't have my speaker here. Where's he coming in?
Hi.
Oh, okay.
Kind of with the Post here. I've got about 5 questions. To follow up on on what Rashad Young just said, you said you were able to preserve $300 million in the capital budget for the new hospital with trade-offs and frankly very difficult choices. What do you mean by that? What are the things that the district can't fund in order to fund this new hospital?
As you know, Finnet, we'll be delivering our budget to the council. I guess it's in a week and a half or so.
In a week and a half, yes,
Yep.
ma'am.
And we will be presenting our capital budget at that time.
But you say that you know the trade-offs and difficult choices that you've made, so why not explain that to residents now?
Because I will be explaining it to them when I present the budget.
And then to follow up on Sam Ford's point, the concerns from Howard University were a big factor when the council considered the new hospital on the St. East campus in 2018. Was it essential to reach an agreement for a new Howard hospital before reaching an agreement for the new Southeast DC hospital?
I think, as you've heard from the CA, that we have been proceeding with talks with Howard University and with UHS and George Washington University simultaneously. And it is important for us to strengthen, because we have the opportunity, two places in our system, at Howard University and at St. Elizabeth's.
And are there any provisions in the deal for the new St. Elizabeth Hospital that blocks or limits unionization at the new facility, or protects organizing and prohibits management from interfering with unionization?
There are no provisions in the agreement that blocks or prevents unionization. We recognize and have been supportive of with the district, and UHS have been supportive of employees having the right to organize and the right to be able to do that in an unfettered fashion. And so there isn't anything in this agreement that suggests otherwise, or prohibits or places conditions on any group's ability to organize.
And then for the
Finnet, are you there? Okay, we'll have to get Finnet back. Amanda from the City Paper.
Hi, thank you so much for hosting this. Follow up on the union question that Finnet raised. So critics of UHS cite anti-union bias. Specifically, like in September, a National Labor Relations Board judge said that UHC and GW broke labor law by engaging in regressive bargaining with unionized workers. How do you respond to those criticisms?
Rashad, you want to talk about? I think I heard her say about. Can you say that again, Amanda? About what you were referring to with a. What did you say?
Right. So, sure. So I know that you said that there are no provisions in the deal that block unionization, but I know critics of UHS have cited anti-union bias on the part of UHS, and like specifically there was a decision from a National Labor Relations Board judge in September that said UHC had broke labor law by engaging in regressive bargaining with unionized workers, and so I'm wondering, how do you respond to those criticisms?
Well, let me just say what I have made clear to UHS is that we can only support an agreement with them and working with them if they follow the expectations that the city administrator just laid out. And we would not expect management, in this case or in any case, from blocking employees' ability to organize. You have any other questions, Amanda?
Yeah, just one last. Was a successorship clause a non-starter?
A successorship clause is a non-starter for us, and I think you have heard the city administrator discuss how we are building a new hospital. This is not a hospital that is a successor organization, and it is not to say, however, that we don't want every employee to have the opportunity to have a job there. Now, this is a smaller facility. There will be fewer employees there. And we're also very focused on DC residents having the opportunity to work there. So those are a number of things that are involved.
And Mayor, if I may add, In the agreement and what we've been able to work out with UHS and with their full support is in fact workforce development initiatives that not only focus on job opportunities for DC residents, but really workforce development programs and initiatives that would support the workforce at UMC who could be and should be eligible for and be focused on for those job opportunities at this new facility. And so in partnership with UHS, we have agreed to have a focus specifically on employees at United Medical Center and provide opportunities for their further training and development should they want that to be as competitive as possible for the new job opportunities that would exist in the new hospital.
Okay, John from WTOP. John?
Hello, Mayor Bowser. Thank you. I wondered if you could comment on today's coronavirus cases. It seems like this is one of the on the worst end of things, and what you might attribute that to.
You are right, John, to mention that we had today, sadly, the highest day of lost lives due to COVID-19 in the district. It continues to focus our attention on the inequities that we're here to talk about today. But it also highlights for everybody that we're not done with this virus in our city and flattening the curve, and we all have to continue to heed the guidelines by staying at home, wearing a mask when going out, especially to do your essential work. And listening to symptoms that your body's telling you, and get tested.
Any advice for people who are starting to feel restless with the stay-at-home orders? Any more advice? I know you've given some in the past, but for people who want to do something this weekend, for instance?
Yes, they should stay at home. And they should only do essential exercise in their neighborhood. They should plan for essential trips like going to the grocery and the like. I continue to see more people, it appears to me, that are kind of traveling around. And if you're going to be out in public places, just keep your distance. Okay, DC-ist. No, who's that? Giambroni?
Hi, Mayor Bowser. This is Andrew Giambroni with DC-ist and WAMU. I just have a few questions, some of which have already been addressed in part. The first is both for you and for Ms. Russo, if she could speak to this. What happened between late 2018 and now to get George Washington University Hospital and its partner UHS to come around to this deal? As we know, back in late 2018, the health system expressed some concerns about labor organizing and other elements of the deal. So what's really happened over the past year and a half?
A lot of hard work, a lot of great conversations, and a commitment to serving residents of the District of Columbia. I think from our part, that's what it's been, and I'll ask the CA and Ms. Russo to comment further.
No, I think that's right, Mayor. It is just hard work and continued discussions and negotiations about how to put this together in a way that served the residents the best, that could create the kind of system and framework that we started with when we started talking about this partnership, and really just putting together all the deal terms that got us to the point we are today.
Agree. I think I would just add that it's around that unwavering commitment that we believe in building an integrated system to help ensure that there's accessible care to all of DC residents that is of quality. And with our partnership with GW, we felt we could deliver that with the focus and the tenacity of ensuring we get to the right deal in order to serve this community.
Okay.
Were there any sweeteners in the deal over the past year and a half? Is the DC government going to be paying more now under this plan than it previously had offered?
So I would say we had in a framework that we started with, and we stayed true to that framework throughout this negotiation. It has always been the district's position that if we were in the driver's seat for the capital construction, that the operating responsibility be with the operator. We kept those tenants before us, I think, on both sides as we proceeded through this negotiation. And certainly, you know, there are dozens, if not hundreds, terms and conditions when you talk about this operating agreement and the lease agreement and the construction agreement and all of the things required to really define what this partnership looks like over a long period of time. But that initial framework where we would drive the capital and the partner would be responsible for the operating, the operations of the facility and the business stayed before us throughout this conversation. And Kim, I don't know if you.
No, well said, well said.
Andrew, was there anything else? Annalisa's next. Annalisa from WJLA.
Yes, hi. I had two questions. One for you first, Mayor Bowser. Are you seeing that the testing site is still working well in Ward 8? How's that working out?
You know, I don't have our latest numbers, and I will say, Annalisa, however, that we continue to push more people. We've talked recently about yesterday, former First Lady Michelle Obama did a series of robocalls for us where we are targeting communities where, you know, all over the city, but certainly people with pre-existing conditions. And so we're sending that out. That has a prompt to connect you to the testing line if you're experiencing symptoms and have been exposed. So that is what we continue to push. We did add another citywide testing site, as you know, at Fort Totten, near the Fort Totten Metro. I should say at UDC Bertie Bacchus. Near the Fort Totten Metro. So we continue to do that. Now that, of course, those two sites are in addition to other sites that are being offered by our system providers.
Thank you, Mayor.
Thank you.
My second question is for Dr. Frederick. Dr. Frederick, you mentioned the fall for Howard University. How do you think that will shape up? And secondly, with the virtual ceremony, how do you think that will go?
I'll start with your second question first. I'm going to leave here and go back to our own media asset at WHUT and actually tape the conferring of degrees is what it is. I want to be clear, it's not a virtual commencement. Nothing can recreate that long walk on our campus. So we will convene that class next May for that purpose. But, you know, it's a sad opportunity. It's a sad moment, to be quite honest. My first graduation from Howard, my grandmother took her first flight to come here, so I know how special those things are. But I think it's important for me to go ahead and confer the degrees, and we'll tape that this afternoon and do it on Saturday, May 9th. On your first question, if you could repeat that again.
Yes, the first part of the question, how do you think things are going to shape up in the fall? Is the plan to bring students back, or are we still thinking that maybe it's not the right time?
Yes, we're planning for face-to-face interaction and classroom instruction. That will be complicated, though, I have to tell you. So we have formed a task force. We've asked the councilwoman from our Ward 1, Brianna Nadeau, to sit on that group. We've invited an ANC commissioner as well, and we're bringing in a public health official as well, because I think it's a very complex thing to look at. We have to look at where students are coming from. Do they have the availability for testing at home before they come back? We have to look at our employee base. We have to look at who is high risk. Do we encourage those students to only have online instruction? Do we have people who have classes on Monday, Wednesday, Friday, come every day? Or do we have half of the people come to class, half stay in the dorm? When people do get tested positive, do we all put them in one place? So the consortium of universities is looking at all of those possibilities. We are discussing where we can support one another. Maybe we all get one building where people can self-isolate and self-quarantine in the city. It's a very complicated circumstance, but we think it's in the best interest to try to bring the students back as long as it is safe. DC has done a good job of social distancing. The curve has flattened, but one of the side effects, as it were, of flattening the curve is that you have a longer duration. And so we have to be considerate of that as well. Our students usually come back in late July. We also are looking at the opportunity to probably even truncate the fall semester, start a little later and maybe even stop a little earlier so that we get out of flu season and get students back home in time. I know nobody wants to talk about the next flu season, but it may behoove us all to probably get our students and faculty off campus as early as Thanksgiving. So we're looking at the full gamut of possibilities, but we are moving in that direction, and obviously we'll plan for contingencies if we can't bring everyone back.
Well, thank you, Dr. Frederick, for that dose of reality. And also thank you for serving as one of our advisory sector committee chairs for Reopen DC. Tom Sherwood.
Thank you very much, Mayor. Can you hear me okay?
I can hear you.
Hello?
Yes,
Mayor.
I can hear you. Can you hear me? Go ahead, Tom. We can hear you.
Okay. All right. Thank you very much, Mayor. I appreciate to have two questions. What is the status of the George Washington University proposal to build a new 120-bed addition on its campus in Foggy Bottom? Is that alive or dead? Is that part of this deal in any way? And secondly, I'm noticing watching it on television that the medical people are wearing masks, but the city officials are not. What does that tell us?
I can't talk with my mask on. I'm putting it on, and as soon as I finish, I'm going to put it on. So that's what it tells you. Talk about the tower, Rashad.
So any addition of bed space or physical infrastructure at GW Hospital at Foggy Bottom isn't related to or a part of the deal that UHS has with us for the construction of the hospital at St. Elizabeth's campus or its operation. So we aren't a party to that or in that discussion, and it's not a factor for our program or partnership.
Is that a proposal still alive? If maybe the George Washington University Hospital person could answer, Ms. Russo.
Thank you for the question, Mr. Sherwood. So at this point, we will continue to partner with GW to determine what any expansion plans look like on our Foggy Bottom campus. At this point, that is not moving forward.
Thank you.
You had a big jump last night in number of positive cases, over 200 now. I think that's the first time you've reached 200. But you've only been able to test 20,000 people so far in the city, in a city of 700,000. Do you see a point where you're going to have enough supplies within weeks, say, where you could test anybody who wants to get a test?
We want to test everybody who needs to be tested, and that is the goal of getting our supplies up. And we continue to procure supplies. We're involved with additional conversations with the White House Coronavirus Task Force, for example. You know, they've made a commitment to provide supplies for 2% of the population for May and June testing. So we want to learn a little bit more about that and, in fact, tell them the numbers that we think we need. So our teams are working on all of those things to get it out.
Right. Secondly, I've asked you over the last several months about some issues at OUC, the 911 center. The website Saturn 911 has been recording a number of incidents recently in which firefighters have been calling and asking for help. There was a cardiac arrest recently where they asked for help and they got no answer at the center, as well as a unit that was under attack and they asked for help and didn't get any answer. There's been a number of times that have been recorded now where they've been getting on the radio and not getting any response whatsoever. A, are you aware of some kind of technical issue where they cannot answer for some reason? Or B, is there a manpower issue because of the coronavirus?
Neither. No, the answer to both is no. And I'm happy to look at the specific instances you're talking about, and we will.
Are you aware of those instances?
No.
You're not. Do you still have confidence in Karina Holmes in running your 911 center?
Not only do I have confidence in Karima Holmes, we are lucky to have Karima Holmes run our 911 center. She is renowned around the country. She has done every job in a 911 call center that there is, from call taker to trainer to supervisor to now being a phenomenal, it's a phenomenal leader of that organization.
Thank you.
Yes.
Will either of the hospitals get any annual operation subsidies from the city as part of these deals?
So there are a couple of things. First, on the Howard, when you say either hospital, you mean Howard University
Howard
or
the
UHS? So for the project that we're working with Howard, our partnership is in terms of investment is in 3 areas. One, the tax abatement, so it's worth $225 million. 2, the $25 million infrastructure investment, which will be reflected in the mayor's capital budget. And 3, the $26 million over 6 years for the Centers of Excellence. And so that is our financial commitment to the Howard Hospital Initiative, those 3 areas. In terms of the partnership that we have with UHS, we have certainly the capital commitment that we are going to invest to create the facility. And then we have what we have called this operating reserve. So within the first 5 years of the agreement, the district is putting forward resources that in the event the hospital runs a negative deficit, they can draw upon a capped and limited amount of money to bring them to a break-even status. If they're better than break-even, then they won't have access to that fund. And if they're worse than break-even, there is a capped amount that is available through the first 10 years of operations. After that 10th year, then the profit and loss stands on its own, and there's no additional subsidy. We're also working, because this is a heavily Medicaid population that we anticipate, we're working to address better Medicaid reimbursement for patients that come into the hospital, which will help support that cost of care.
And then can I just ask, and I know you talked about level 3, level 1 trauma center, and I appreciate that, but just to people who are looking at this and feel that it's inequitable, that East of the River isn't getting, and I know what you said about not every neighborhood needs one, and we have 3, but just to go back to these people who are going to say that just seems inequitable to them, that they're not getting the same level of care available to them in their community that people on the other side of the river do get.
So let me just address this again. This hospital will see thousands and thousands and thousands of patients. A very small number will be gunshot victims, as we refer to. And it isn't inconsequential that a person suffers from and is a victim of gun violence and needs medical care. We take that very seriously, and this mayor and this administration has focused intently on gun violence and violent crime in a number of ways, in addition to through what we're trying to do with our health system. And in part, in fact, of our investment with Howard University is around violence prevention and studying violence prevention and having better ways to prevent those things from occurring. But in terms of the inpatient facility in the hospital, thousands of patients will come. A very small fraction will be the victim of this kind of, or have this kind of care need. Even being said, if you receive a critical wound of any sort, whether it's a gunshot victim or a very bad accident, this hospital will be well equipped and have the resources and staff available to stabilize that patient, which will in fact be able to save people's lives. If then the treatment or level of care is a more complicated procedure, there's a process within this system. That's why we're creating a system of care. There's a process within the system to have that patient be able to be transferred to receive a higher level of care to repair whatever damage that the emergency caused. But we should be very clear that if people have an emergent circumstance, we don't want people to think, and your question shouldn't leave people to think, that they can't go to this hospital and receive the care that they need to save their life, because that just wouldn't be true. So there'll be the resources, the equipment, the staff, the expertise to stabilize a patient. And the further repair of that emergency from a health perspective will be done within this system.
Just if I could just follow up, and I get that somebody can show up and they'll be taken care of, but to the paramedics who are transporting, if there's not a surgeon on duty and they're transporting a gunshot victim.
But I think, well, hold on, but I think you had asked that question earlier. Is there going to be a surgeon on duty? Yes.
There will be a surgeon on duty, and I think there's the other component when we think of level 1. The biggest differentiator of level 1, and Dean Bass, as a surgeon herself, may be able to add in, is really around research and that academic component related to injury and injury prevention and the disorders that come in from an emergency. So there will be surgeon available, and our goal is a comprehensive continuum of care that is integrating that academic medicine to ensure that the quality of care is available to all DC residents, period.
And I appreciate that, but I hate to split hairs, but available and on duty are two different things. And I don't hear a category.
So let me just say this too, because the agreement contemplates that we have a slide here that talks about the kinds of services that will be available at this hospital. But the other piece that has been important in this discussion, and that UHS has said and Kim has represented, is that we're engaging the community about the very specific and exact lines of service that will exist at this hospital. And so part of the community engagement process and part of how we will talk to the community about what services will be in this hospital is going to be driven by that conversation. But it is our full expectation, and we're sitting here in April of 2020 about a process where a hospital will be built in 2024, but there is a process of discussion about those very exact and specific lines of services and the volume with which those services can be delivered. And we'll have that conversation with the community. But we want to be very clear. It is our full expectation, both from our operator, from the physicians who will service it at George Washington University, and from the District of Columbia, that we will have those kinds of services necessary to take care of emergent circumstances that walk through that ER door as an adult patient or a pediatric patient.
Infinite?
Hi, Senate here with just 2 follow-up questions. City Administrator Young, you mentioned having reserves that the hospital can draw on for operating expenses for 10 years. How much money is that over 10 years?
No, it would be available for 10 years. We're going to provide that as $25 million, which will be provided over the first 5 years, which will be available for 10 years. So $5 million a year for the first 5 years will go into this fund to help with any operating losses that occur, because what we know is when we build this hospital anew, and there will be a period of time for that hospital to ramp up its operations and its volume so that we can meet, the operator can meet the projections that we have discussed with them in the operating agreement for those operations and that revenue to be able to take care of all of the expenses. So that ramp up period we have for a 5-year period of time, $5 million a year. So there's a up to $25 million fund that would be available for the first 10 years of its operation.
Got it. And then for Ms. Russo and Dr. Frederick, how are you planning to find a viable financial model for serving predominantly poor Medicaid patients when so many other hospitals have encountered challenges or failed?
That's what we've been talking about for the last half hour, how complicated it is and why it requires a public-private partnership to have a private model that is sustainable for very costly provision of services. But I think what we all see is that that's precisely the government's role, to get in and get the best of the best at the table and tell you what it's going to take to make that happen. We've been talking for a lot of years about the district getting out of the hospital business, and this is what it takes. It takes bold plans, a robust investment, and it takes being strategic about how we deliver those services. And I think that's exactly what we have here. Okay, thank you, everybody. Oh, do we have some?
Slides that Dr. Nesbitt put up that talked about the most stringent case for reopening would be starting in 3 months, and then the least stringent case for reopening would be 2 to 3 months. And I'm just wondering when that 2 to 3 months from when that started. It was in this. It was in the deck that you guys put out yesterday.
Mm-hmm. I'm not sure exactly which slide you're referring to, but we've been very consistent in how we talk about what we need to see in terms of starting to turn our economy back on. And that's seeing decreasing cases over a sustained period, 14 days, seeing decreases in our instances of transmission, having our healthcare system ready to operate in the non-crisis setting, as well as making sure that our supply chains can support our PPE needs. So those are the types of things that we're looking at.
So is the best case scenario, though, that you wouldn't begin a partial reopening for a couple months from now?
We haven't said that, no. Is there something else I need, Jackie? Oh, I need to sign the agreement. And for Tom Sherwood, everybody else has signed, so we're not passing this along, which is important. And now I've signed. Thank you, everybody. Thanks for the hard work and the partnership. Thank you. Thank you.